Health insurance can be frustrating. You hear words like copay, deductible, coinsurance, out-of-pocket maximum, and premiums. You may not know what those terms mean, but you might notice that they're all going up. You may also notice you have more money taken out of your paycheck, or that you spend more money when you go to the doctor, or an increase in the price of prescriptions you pick up from the pharmacy. We think you deserve better. We've created a health plan that rewards you for making good decisions and helps you get the right care at the right price. It's called an HSA-based health plan, and it's the plan you have with us, your new health insurance company. Our goal is to stop the ever-rising costs of health insurance. To do this, we need your help. As we work together, we think we can start lowering healthcare costs. Now, let us explain how your new plan works. Your plan has two parts. First, there's health insurance, which protects you in case you have a large medical expense or a lot of small expenses that add up to large medical expenses. Either way, with health insurance, you're protected from daunting out-of-pocket costs. The second part of your plan is the health savings account, also known as an HSA. An HSA is a tax-exempt savings account that you use to pay medical expenses before insurance starts to pay. One of the great things about an HSA is that if you don't spend the money in your HSA, you keep it. That's right. The money in your HSA is your money. The more money you save, the more money you'll have available for future medical expenses. The money in your HSA can come from three places. Your employer can put money in your HSA. You can put money in your HSA, and we, as your insurance company, will put money in your HSA. We'll talk about that a little later. It is very important to remember that you keep any money you do not spend from your HSA. Unused funds from your HSA roll over year after year and can be used to pay for future medical expenses or even be used as another retirement account. Let's say you put $1,000 a year in your HSA and your deductible is $2,000. If you spend $500 a year on medical expenses, then $500 of your HSA savings would roll over to the next year. If you put another $1,000 in your HSA the next year, then you would have a total of $1,500 in your HSA. And if you only spend $500 on medical expenses like the previous year, you would then roll over $1,000 to the next year. By the end of year 3, you would have $2,000 in your HSA. If your deductible is $2,000, you now have enough money in your HSA to pay toward it. As you can see, if this scenario played out year over year, soon you'll have more money in your HSA than your deductible, which is the best case scenario. In a traditional plan with copays, you never roll any money over and your deductible starts over every single year, regardless of whether you used your plan or not. Now you can see why an HSA-based plan can be the future of health insurance. Our goal at HSA Health Plan is to help save you money and grow your HSA. We have 4 programs to help you do this. Earning money for your HSA. The first way is through an incentive program. We will put up to $250 per year for an employee-only plan and up to $500 per year if your spouse or significant other is on the plan. If you walk 8,000 steps a day, 20 days in a month. At the end of this video, you'll have the opportunity to learn exactly how this program works, helping you save money and keep it in your HSA. The second way we do this is through pricing transparency. We believe that you should be able to see how much each provider charges for a given procedure. This information is available on the website, or you can always call us. Rewarding you for helping lower the cost of healthcare. The third way we help you get money in your HSA is through our shared savings program. Did you know that an MRI can cost $400 or as much as $6,000? A knee replacement surgery can cost $20,000 or as much as $60,000. With healthcare, the cost is not always correlated with the quality of the care you receive. HSA Health Plan has partnered with certain provider organizations that will give you and us the lowest price if we pay for the service on the same day the service is received. Because we get an additional discount for paying fast, we give you a part of the savings as a contribution into your HSA. Using this process, you could earn $250 in your HSA for an MRI or as much as $3,000 for a knee replacement. To qualify for this program, you must call us first. Remember, we are available 24 hours a day, 7 days a week. Keeping money in your HSA. The fourth way we help you save money is through our prescription drug patient assistance program. If you're taking expensive prescription drugs, we might be able to help you get enrolled in a patient assistance program to see if you can get your prescription drugs at no or little cost. If you're paying over $100 for a prescription, call us to see if we can help. Insurance companies contract with providers and hospitals to offer a discount for services to their members. This is called a network. There are over 7,000 doctors in our network in 39 hospitals in Utah. If you live out of state, we use a network called First Health. In Utah, if you live along the Wasatch Front, the hospitals in the network include Brigham City Community Hospital, Ogden Regional, Davis Hospital, Lakeview, Salt Lake Regional, University of Utah, Primary Children's, St. Mark's, Jordan Valley West, Lone Peak, Mountain Point, Timpanogos, and Mountain View. If you live outside the Wasatch Front, all the hospitals are in-network. It is always a great idea to call us before you go to a hospital so we can make sure it is in-network and we are getting you the best price possible. If it is a life-threatening emergency, you should go to the closest hospital. All emergency care will be considered in-network for that visit. If you have any questions, call us at 844-234-4472 24 hours a day. Now that you're a member, you'll receive 2 cards, an Insurance ID card and an HSA Visa debit card. Show the Insurance ID card when you go to the doctor or pharmacy, and use the HSA Visa card to pay for medical expenses until you reach your deductible. We're excited to start helping you win with healthcare. We want to help you grow your HSA by helping you get the most efficient care at the right price. If you have any questions, call us at 844-234-4472 24 hours a day, 7 days a week, or visit us at hsahealthplan.com.